Imagine this. Your loved one is sitting at the table mid-conversation when suddenly their words become slurred. They try to lift their coffee cup, but their hand won't cooperate. A few minutes later, everything seems fine again. No pain, no lasting effects. So you brush it off. But what if I told you this could be a mini-stroke, a transient ischemic attack, or TIA, a warning sign that a major stroke could be right around the corner? Now imagine another scenario. You're walking with your elderly parent when for a brief moment, they seem confused about where they are. It's subtle, just a few seconds of disorientation, but then they shake it off and continue as if nothing happened. Most people wouldn't think twice about it, but should they? Could these fleeting moments be tiny windows into a much bigger health crisis? Mini-strokes are the silent alarms of our bodies. Unlike full-blown strokes, they don't leave permanent damage, but they're a clear signal that something is wrong. Recognizing these signs early can save a life. Many elderly individuals experience these warning signs but dismiss them because they fade quickly. However, ignoring them can have devastating consequences. Today, I'll share 9 crucial signs of a mini-stroke in the elderly. Signs that often go unnoticed but should never be ignored. 1. Sudden weakness or numbness. One side of the body, an arm, a leg, even just a few fingers, feels weak or numb. It's sudden and it passes quickly, but it's a red flag. This isn't just a random cramp or sleeping in the wrong position. It's a sign that blood flow to the brain has been temporarily blocked. The scariest part? It might not happen again until a major stroke strikes. By then, the damage could be irreversible. If your elderly loved one ever mentions a fleeting numbness, don't assume it was nothing. Get it checked. 2. Slurred or confused speech. Words start to slur, sentences don't make sense, or there's a sudden struggle to find the right words. It's not just old age, it's a warning. Speech is one of the clearest indicators of a neurological issue, and when this symptom appears and disappears, it's easy to ignore. But it shouldn't be. Many people think, oh, they were just tired, or maybe they were distracted. But when speech suddenly becomes jumbled for no reason and clears up just as fast, that's not normal. It's a flashing red light. Before we jump to the next point, to keep this channel going, please hit the subscribe button. It truly makes a difference. Thank you. 3. Vision problems. Blurry vision, double vision, or temporary blindness in one eye. These are all signs of reduced blood flow to the brain. A TIA could be cutting off oxygen to the part of the brain responsible for sight. Even if the vision returns to normal, this is not something to dismiss as mere eye strain or fatigue. Some people describe it as a shadow in their vision, like a curtain falling over one eye. Others report seeing flashing lights. If vision problems appear and disappear suddenly, it could be a mini-stroke warning that a full stroke is looming. 4. Sudden dizziness or loss of balance. Feeling lightheaded, stumbling, or struggling to stand. The brain controls balance, and when blood flow is disrupted, so is coordination. Many elderly people assume that dizziness is just part of aging, but a mini-stroke can be the real cause. If dizziness comes on suddenly and feels different than usual, it could be a sign of TIA. Picture this. An elderly person stands up and suddenly feels like the room is spinning. They grab onto something for support, but a minute later they feel fine. It happens again a few days later. They blame it on dehydration. But what if it's a sign of something much worse? 5. Severe headache with no clear cause. A sudden, intense headache, out of nowhere. It might not seem serious, but it could be the brain's way of signaling distress. If it's the worst headache they've ever had, or if it comes with other symptoms like dizziness or vision changes, don't ignore it. This isn't your typical stress headache. This isn't dehydration. If someone experiences a thunderclap headache, a sharp, intense pain that hits suddenly, it's time to seek medical help. 6. Difficulty understanding others. A mini-stroke can affect comprehension. Your loved one might look at you as if they don't understand what you're saying, even though they should. It's a chilling experience to see someone you know suddenly struggle with something as basic as conversation. You ask them a question and they pause, confused. They try to respond but hesitate as if their brain is taking longer than usual to process. This might last only a minute or two, but it's a serious warning sign. 7. Brief loss of consciousness or fainting. TIAs can sometimes cause temporary blackouts or fainting spells. If someone faints with no obvious explanation, it's time to investigate. This can be mistaken for dehydration or exhaustion, but if it happens without warning, it could be a sign of a mini-stroke. Think about it. Fainting means oxygen momentarily stopped reaching the brain. That's a medical emergency waiting to happen. 8. Tingling or unusual sensations. A mini-stroke can cause odd sensations, like pins and needles, burning, or an unexplained numbness that lasts a few minutes. These fleeting sensations can be dismissed as circulation issues, but they might indicate something far more serious. If you hear an elderly loved one mention weird tingling in their hand or foot that appeared out of nowhere, don't just brush it off. It could be the brain's way of signaling distress. 9. Sudden memory lapses or confusion. A mini-stroke can momentarily disrupt memory and thinking. Your loved one might suddenly forget where they placed an item, struggle to recall a familiar name, or even feel confused about their surroundings. These brief memory gaps often get brushed off as senior moments, but they could be a warning sign of something more serious. Imagine an elderly parent momentarily forgetting how to get home from a familiar store, only to remember a few minutes later. It's easy to overlook, but these momentary lapses in cognitive function could indicate reduced blood flow to the brain, a warning that a major stroke may follow. The danger of ignoring these signs. Now here's the scary part. These symptoms disappear within minutes to hours. That's why many people ignore them. But ignoring a mini-stroke can be fatal. Studies show that 1 in 3 people who experience a TIA will have a full-blown stroke within a year. That's a frightening statistic, but it's also an opportunity to intervene before it's too late. So what should you do if you notice these signs? Act fast. Face, is one side drooping? Arms, can they lift both arms? Speech, is it slurred or strange? A time, if you see these signs, call emergency services immediately. And here's something even more important. Don't wait for symptoms to pile up. Even one of these signs is enough to warrant a doctor's visit. Mini-strokes can be a ticking time bomb, and acting quickly is the best way to defuse it. A mini-stroke isn't just a warning, it's an opportunity to prevent something far worse. Recognize the signs, take action. Encourage your elderly loved ones to prioritize their health. Get regular checkups, and address risk factors like high blood pressure and cholesterol. Because the best way to fight a stroke is to stop it before it happens. Thank you, and see you in next video.